As COVID-19 cases increase, so do questions about immunity. Well, joining us now is the chief of GBMC's Division of Infectious Diseases, Dr. Theodore Bailey. All right, so welcome back to BMORE Lifestyle. So this is everything that we're talking about this week, right, especially going into the holidays. Can you briefly address the debate over protection provided by natural immunity versus the COVID-19 vaccines?
Sure, and I think one of the quick answer, and then we can kind of unpack it, really is that with the three-shot series, we see dramatically better protection against COVID than we do with natural immunity. And to understand why that would be so, one is that to recognize that infection, which is what gives us natural immunity, is not some one thing. There's I had COVID, you had COVID. Actually, I haven't had COVID, but a variety of people have it, but it's not the same thing. Some people had severe, some people had long drawn out ones, some people got it from small exposures, some from big. So it's not standardized in a way that the vaccination itself is standardized. The other part is that even with the two-shot series, there was built into it this second shot, which is a booster, which really tells the immune system that this is something to pay attention to. This is something that is worth really ratcheting up and maintaining immunity for. And then the third shot does that in spades. There's been a little bit of conflicting data. We don't know that there's protection from it, and probably some people, a minority of people, but when it's hard to know who it would be, may have a longer lasting protection than other people who got the infection. But the vaccine is far more consistent and reliable with a lot less variation. And the level of protection with the third shot goes up 95% more, even from what two shots did. Wow. So that combination really is better. The other question is, should somebody who's been infected get vaccinated? And we also know that comparing the previously infected and unvaccinated to the previously infected and vaccinated, that group who gets a shot afterwards actually have further protection against reinfection as well. So that's part. And again, you know, if you're going to try to go for natural protection, that means you're rolling the dice. You have to get infected, which means you're rolling the dice on something that's difficult to treat and has caused really countless deaths. So it's not justifiable to try to expose the population to that.
For sure. Now, I know we see a lot of people, we see debate about it on our Facebook page here. Can we talk about which one fades first, the natural immunity or the immunity that you get from the vaccine?
Well, so I think one of the things that's led to some confusion on that was, I think, a study that came out of Israel, and most of their data is excellent, but it's like any country, it's got a diversity of expertise. It was a study that looked kind of midsummer this year, and it looked as if people who had been previously infected were not having as many of the infections that they were seeing during the summer. But the issue there was something that we learned called survival bias, which is to get reinfected after COVID, you have to survive COVID. Exactly. And one of the ways to really take that study was just that dying from COVID turns out to be extremely protective against getting reinfected. But that was not perceived or recognized in some of the casual interpretations of it. So when you actually factor that back in, the vaccine still remains far superior in terms of protecting against death, because you could either die from your first infection or your second. But the vaccine is going to protect against both of those scenarios.
For sure. Thank you. I mean, we need actual information during this time. Dr. Bailey, thank you so much for being here with us today. We appreciate you. And again, we will post this on our website, foxbaltimore.com. Of course, our viewers know where to find you at GBMC. We appreciate you.
Happy to help.